Hello and welcome. You're watching Health and Wellness, Save a Life. I'm Gargi Rawat. Even young adults are suffering from sudden cardiac arrest due to sedentary and stressful lifestyles. Without immediate recognition and CPR delivery, the chance of survival decreases significantly as each minute without life-saving interventions passes. It has been proven that bystander CPR improves the rate of survival by almost 50%. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. Today we're joined by Dr. Sachin Patil, interventional cardiologist and chairman, Sachin Multi-Speciality Hospital, Kolhapur, Dr. Kumar Kenchappa, consultant interventional cardiologist, Manipal Hospital, Hebal, and Dr. S. Viswanatha Kartik, consultant interventional cardiologist, ANU Institute of Neuro and Cardiac Sciences, Vijayawada. Thank you so much, doctors, for joining us on the program today. Dr. Patil, with aging, there are changes in the cardiovascular system which result in alterations in cardiovascular physiology. So what are the changes in aging associated with the cardiovascular system, if you can explain for the viewers?
Yes, aging is an inevitable part. So this aging process affects all the parts of the cardiovascular system. Mainly, let's say the heart. So the heart function and the elasticity goes down over a period of time, and that's why it becomes less elastic, and the functioning capacity slightly goes down. Even with the age, there is deposition of fibrous tissue and calcium on the valve, so the valve becomes more thicker and their functions may affect, and that's why down the line we are seeing now more and more people having the valve problems in the later part of their age. Even the conduction system, means the rhythm controlling system, ages, and that's why there is more incidences of misbeats or arrhythmias like atrial fibrillation or ventricular tachycardias, which increases with the age. Obviously, with the age, the arteries also ages. With the vessels which conduct the blood, they become thick. Generally, there is a deposition of cholesterol into that, and they become stiffer. And what we say in layman language, that the blockages have come. So that needs to be checked. With the age, blood pressure also goes up, and with the age, the risk increases due to the other risk factors also starts building up, like blood pressure, diabetes, and all this in a conglomerate forms a cardiac problem. So age is the important risk factor for the heart.
All right, Dr. Kenchappa, it is seen that heart attacks are more common in obese people. So if you can explain to us, what is the relationship between obesity and cardiovascular disease?
Yeah, rightly said, obesity increases again stress on the heart. Obese patients will have other comorbid conditions like diabetes, hypertension, which are again a risk factor for heart diseases. So once you are obese, it increases the cholesterol, the bad cholesterol that we talk about in the body. It not only increases the bad cholesterol that we talk about, it also decreases the good cholesterol in the body. So once there is a cholesterol accumulation in the blood vessels, which leads to heart attacks, that in a layman's word. So obesity increases the cholesterol, it has other comorbid conditions, and it also increases your blood pressures also. So once your blood pressures are high, the cholesterols are there in the cholesterol crystals are there in your blood vessels, the endothelium that we call about, the inner lining of the heart, that breaks up, and this can lead to increased heart attacks in the obese patients.
All right, Dr. Kartik, what's the difference then between good and bad cholesterol? Can a person lower the risk for heart disease if he or she lowers their cholesterol levels?
Yeah, mainly there are many types of cholesterol. It means like there is something like a triglycerides, VLDL, low density lipoproteins, HDL cholesterol. These are all different types of cholesterol. So the HDL is usually called good cholesterol, and the LDL is something called a bad cholesterol. So the LDL, the levels should be very strictly regulated in the body, and even in these heart attack patients also, we tend to control these LDL levels, because the higher the LDL level, it causes a dyslipidemic state where we will called it is more prone to heart attacks. So mainly the LDL level should be reduced. The ideally LDL level less than 80 is the best, and less than 100 is also acceptable. But if the LDL level crosses more than 100 or 120, then we need to worry and we need to use some medication called statins, where they decrease the LDL cholesterol. So always reducing the LDL is a very good thing, especially in these heart patients. And even normal people also, they should try to control their LDL levels.
All right. So, Dr. Patil, going forward from there, is it true that foods rich in both soluble and insoluble fiber help to reduce the risk of cardiovascular disease and coronary heart disease?
I think that's a great question and often neglected part, because slow and steadily we are moving towards more processed foods, or which are available in the malls and which are poor in fibers and soluble fibers. It has been clearly observed that if we consume a recommended amount of fibers in the diet, it reduces the risk of having a heart attack by almost 16 to 20%. And these fibers not only reduces the risk of heart attack, it reduces the risk of cholesterol. It reduces the cholesterol by 20 to 30%. It promotes the growth of beneficial bacteria into the gut. So we say it's a probiotic, right? It not only relieves the constipation, but it keeps your gut very healthy. Then it reduces the risk of diabetes, because these fibers catch hold of the sugars and then they are excreted, and that's why it reduces the sugar, it reduces the insulin requirement for the diabetes. Plus these fibers feeds those good bacteria and reduces the risk of inflammation. So by reducing the cholesterol, weight, diabetes, better blood pressure control, all this contributes to the growth of cardiovascular system or betterment, and reduces the risk of heart attack by 16 to 20%.
Right. Dr. Kenchappa, now it's a well-known fact that heart disease doesn't happen just to older adults. Which heart problems are more common than in young adults, if you could tell us?
Yeah, this is the current hot topic, isn't it? The people, younger adults having a heart attack, especially after the COVID pandemic, we are seeing a lot of young individuals having a heart attack. So, younger adults now have high blood pressures, as we already discussed. They have obesity. They are, as Dr. Patil was telling, they are more into junk eating. So all these things lead to heart attacks in the young adults. So that is one type of heart diseases that can be present in the young adults, and that is the most common that we are seeing of late. So that is not the only thing which can cause sudden cardiac death in the young adults. There are other conditions which can be there from the birth itself, like hypertrophic cardiac myopathy, wherein the wherein the muscles in the heart are very thick, and that obstructs the blood flow in the heart, and in turn it can lead to sudden cardiac deaths and lethal arrhythmias that can occur in these sort of patients. So it is also very fairly common to the extent that 1 in 500 of general population might be suffering from this hypertrophic cardiac myopathy. So other conditions like valvular diseases, in India especially rheumatic heart diseases or congenital mitral valve prolapse, these can be present in the young individuals, and coronary artery anomalies, that is the coronary arteries are the blood vessels which supply the heart. So they can be arising from a different position, or they can be in between two different vessels or in between two muscles. So these are all the things which can lead to heart attacks or which can lead to sudden cardiac death. So coronary artery disease causing heart attacks, then hypertrophic cardiomyopathies which can give rise to arrhythmias and again sudden cardiac death, and coronary artery anomalies and valvular abnormalities. These are all the conditions that we can see in young adults now.
All right. Dr. Kartik, which cardiac test should one perform regularly? Can regular monitoring through these tests then help prevent heart attack or cardiac arrests?
Yeah, so the main test to know whether there is a heart disease or not is, first thing is an electrocardiogram. Commonly we call it as ECG. And the next is the echocardiogram, which we commonly call the echo, and other is a treadmill test. So these three are the basic cardiac tests, and before that there are some blood investigations also. Like suppose if patient is having some chest pain, they should undergo a routine complete blood picture, hemogram, kidney function tests, and the specific cardiac test is a troponin. So whenever anyone having any chest pain, the first test blood test they should undergo is a troponin. So even the mild elevation in troponin, the troponin I specifically. So the troponin I, if even there is a mild elevation, it indicates that there is some problem with the heart, and it indicates the early heart attack. So those patients who are anyone common people who are more than 35 or 40 years of age, or suppose they are having any symptoms like when they are walking they are having some chest pain, or when they are having some breathing difficulty, or when they are having any giddiness episodes. Even young people also, as the previous doctor they already said, the young people also they are getting heart attacks and sudden cardiac deaths these days. So getting these basic tests done like electrocardiogram, echocardiogram, and the treadmill test, we can know at least the basic structure, like how are the valves functioning, or is there any blood leakage, or is there any blocks in the heart. But the final ultimate test to know whether there are blocks in the heart or not is an angiogram. So before undergoing angiogram, people like a screening every year, they should undergo ECG, echo, TMT and blood tests, so that even we can detect these heart problems at a early age.
Right. Now, you spoke about keeping fit and, the type of food you should have to remain healthy. And Dr. Patil, now cardiac arrests also we're hearing are often happening in gymnasiums or while doing exercise at home. So explain this to us.
Yes, that has been often seen, and now that's very unfortunate. It's been noticed that almost 16% of the sudden deaths which happens in the house are into the exercise facility areas like gymnasiums. It's because commonly, you're trying to do too much in a short period of time. It has been shown clearly in the science that moderate intensity exercise is associated with the reduced cardiac events. But vigorous exercise or doing too much exercise is bad, and it can, disrupt the blood vessels or their linings and can promote a cardiac arrest also, which last year we have seen so many, including the Bollywood and Hollywood star arrest, and this thing has come into the surface. So what is recommended is that it should be a moderate intensity or cardio exercise. It's a very simple formula. 220 minus your age is your 100% of the heart rate. So if one is not used to do the exercise, we can just start with the 50% of the rate. Let's say my age is 40, for example. So 220 minus 40 is equal to 180. So that is 100%. So I should start somewhere with the 50%. The exercise which will raise my heart rate about 100 or 110. Start with those exercises and then build it up over a period of time and then increase it. Vigorous means what? If it is more than 70 to 75% of the capacity is vigorous, or intense means it is 85 to 90%. And this happens because they want to gain the muscles, they want to develop a six-pack within few weeks of time. And the heart and your system is not prepared for it. And that's the reason seemingly fit people are getting into the cardiac arrest because of this. So one has to start slow and then build it up your capacity. Anything in intense or vigorous is bad. Moderate intensity is something recommended, like swimming, cycling, jogging. These are the examples of moderate intensity exercise.
All right, and that's why many doctors also feel that those who work in gyms should know CPR, at least the basics. We'll slip into a short break right now, and we have many more questions to ask our doctors. Do stay with us. Welcome back. You're watching Health and Wellness. Let's go across to the doctors now to learn more about heart health. And Dr. Kenchappa, survival from sudden cardiac arrest is possible with fast, appropriate medical care. How soon should CPR be started after cardiac arrest? And if you can explain the things to keep in mind before starting CPR.
Yeah. CPR should be initiated as early as possible. Okay, CPR. One thing that we always remember is that a early and good CPR goes a long way in determining whether the patient is going to survive the cardiac arrest or not. Okay, the first before starting the CPR, first you have to make sure the surroundings are safe for you to approach. Patient might have had a electrocution, patient might have had a RTA, road traffic accident, patient might have had a fall. So you should make sure the surroundings of the patient is easy for you to approach or safe for you to approach it. One. Second one, you should make sure the patient is had a cardiac arrest. You should a tap on his shoulder, a tap on his back, and make sure that he is not whether he is going to respond to you or not. There is no point in giving a CPR in a conscious awake patient. So you have to check whether the patient is conscious or not. Third, when you are doing a CPR, you should make sure you do a proper CPR. For that, the public needs to be educated, and the people have to volunteer themselves and attend a basic life sciences classes to learn basic CPR that can be given anywhere. And the fourth most important is CPR should be always given in a lying down position. Never make a patient sit on a chair or sit on a desk or something like that and give a CPR. That is not going to work well. So these things you have to keep in mind. That's your answer for the second part of the question. The first part of the question, how soon it should be? It has to be as soon as possible, as early as possible. So the circulation time that we say, the oxygen reaching the vital organs of the body, like the brain or the lungs or the liver, when we are giving CPR, the most important thing that we want to keep in mind is that the blood circulation to the brain is maintained so that all the rest of the body, respiratory as well as other things are taken care of. So the circulation time we say is around 6 to 8 minutes. So basically, if you don't start a CPR before 6 to 8 minutes, so the CPR might not be successful. So as early as possible, we need to start the CPR. We have to make sure the patient is in supine position, that is in the lying down position, and to make sure the patient is not conscious or patient is actually at a cardiac arrest. And third, if the environment is clean. And when we are giving a CPR, you have to see whether the chest or the chest wall is moving up and down properly or not. So if your chest wall is not moving up and down properly, then your CPR is not going to be very effective. In the meanwhile, when you are giving a CPR, it is always listening to call for help from others and call for an ambulance or for a facility which is close. So if you keep all these things in mind, then your CPR will be successful.
Right, and taking further, from that, Dr. Kartik, how would a layperson know if he or she is doing CPR with the right technique, and what are the exact steps?
Yeah, mainly the thing is, whenever if you see any person suddenly losing consciousness beside, first, as the doctor said, first we should know whether the patient really needs CPR or not. We should see whether the patient is breathing or not. If the patient is totally not breathing, and everyone should learn to check the carotid pulse also, which is very important. So at least seeing a neck pulsation, it's very prominent. And just if you keep the tips of fingers on one side of neck, we should not press both sides again. That's very important. If you press both sides, again you are decreasing blood supply to the brain. At least one side, if you just palpate like this and check, you can clearly feel a pulsation on your hand. If you are able to feel that, then it's no need of CPR. If the pulse is not there, then definitely you should, the people should start doing the CPR even if it's a lay person. So those who don't know CPR also, they should always try to do something, because doing something is better than doing nothing in such a instance. Even there are some people, I know some patient attenders who just gave some form of chest compression, brought to hospital, and we did the further job. So doing something is always better than doing nothing. So, and also the compression also, they should, many people think like heart is on left side of chest and they give the compression over the left side of chest. That is wrong. They should try to give the compression in the middle of the chest, that is over the sternum bone, where they should press continuously for at least 100 times per minute. 100 times per minute they should constantly press, and meanwhile, first thing what they need to do is they should call for help. which is very important, because not only the cardiac activity, we need the patient respiration also, which will be given with some ambu bag or other equipment if the ambulance arrives soon. So they should first call for help, and also they should give at least 2-inch compression over the middle of the chest for at least 100 to 120 times per minute, and they should check the carotid pulse at the same time, so that that is a way of giving effective CPR. And once any healthcare personnel arrives, they will take care of the further job. So we should be, and doing that is very important, because we should be brave enough to do the CPR, because many people even lack knowledge about this, that we have only very few minutes left. So even the few minutes of pumping the chest and preserving the blood supply to the brain, it helps a lot after the patient gets admitted to the hospital.
All right. Dr. Patil, we were speaking earlier about exercise. If you can tell us more about that. Regular physical exercise keeps you fit and fine. Can exercise relieve stress? And which are the best exercises for cardiac patients?
It's a very important topic you raised upon, exercise and the mental health. No, exercise not only keeps you fit physically, it keeps you fit mentally also. Because all of us, when we do exercise, we sweat, we start feeling breathless, but we are happy. The reason is because these exercise releases certain good hormones. They are called as endorphins. So that releases the stress, makes you feel better. Those who do regular exercises has a reduced risk of depression because of the serotonin which is secreted by the exercise. So they are less prone for depression. Those students who study plus do regular exercise or engaged into some kind of sports, they have better focus and better concentration capacity. Even their scholastic performances were found to be better. It's because exercise makes your skills better. It neurocommunicates your brain, and that's how a person is more wiser and more intelligent. Plus, exercise promotes, developing the new friends wherever you are going, to the swimming tank, gym, everywhere. And that communications, opening up, sharing things, reduces a lot of stress and develops a good mental health. So that's why stress and mental health is very closely related. Now, examples of these activities or recommended is any activity which involves fast repetitive movements like swimming, cycling, jogging, running, Zumba, dancing. So all these are activities, and especially after 40s, those who are, your muscle starts aging, the ligaments are weak. So these kind of exercises promotes the health, not only for the heart, but overall as a well-being. So that's why these exercises are important. That will, and avoid racing it too much. Let's say swimming, no need for any intensive. Anything in excess is bad, right? And I certainly want to, stress upon is our yoga, our age-old science. Involves doing, the own body, doing different postures. That promotes the health excessively. Plus pranayam, which balances our nerves, reduces the risk of arrhythmias, and generate the promote or the cardiac well-being. So all these things can be done. If possible, I always recommend, get your medical test done initially. See to it that are you fit enough to start with that, and then venture into these exercises, and day by day slowly you increase it. It will help you in a long run.
All right. On that note, that brings us to the end of this program. Thank you, doctors, for joining us and creating awareness about this issue. Thank you all for watching at home. Goodbye.